Hello, can you guys hear me? Hello.
Yes, yes.
Yeah.
Oh, okay, perfect. So, okay, just give me a second. So today we are going to discuss some pathology which were like remaining yesterday. Just give me a second. Okay, so can you guys hear me? Okay, so let me just first of all share my screen. Okay, can you guys see my screen? Hello.
Yes, sir.
Okay, perfect.
Yes.
So, if you guys remember, we discussed a pathology. If you remember, like it's mainly pathology of your, like I would say your immunology. In the immunology, we discussed a pathology. If you guys remember, paroxysmal nocturnal hemoglobinuria. Remember, like it have to deal with or it's related highly with your immunology concepts. So today again we are going to discuss that in this in today's topic, that is paroxysmal nocturnal hemoglobinuria. Okay. So, okay. So, can you just guys tell me what do we mean by the name paroxysmal nocturnal hemoglobinuria? What do we mean by paroxysm? Yes, anyone?
It's like attacks. Like it's not something
Okay, like
constant.
this pathology happens sometime, right? Not like constant, right? Nocturnal, it mainly happens at night, right? It's nocturnal. And what do we see in this pathology? Hemoglobinuria inside the urine. We are going to see hemoglobin, right? So how do we see hemoglobin in urine? You should think of that, yes, there is some hemolysis going on, right?
Yes.
Because once you have hemolysis, then you are going to see destruction of your red blood cell. And what happens? Its content, that is hemoglobin, is going to come out into the blood. From the blood, it's going to come out in urine. And what happens? Then you're going to see hemoglobin in urine. So looking towards the name, like almost like most of the concepts are clear, right? But if you guys remember, we discussed that, for example, if this is our red blood cells, right? So there are certain molecules, they are basically known as GPI anchors. On the surface of GPI anchors, basically you have, yes, what do you have? Decay accelerating factor, right? Decay accelerating factor. And as we discussed that your red blood cells or your blood is in close proximity with your complement system, right? So nature have given the ability to red blood cells, to in order like for the complement system, to keep itself away from complement system or to keep itself, protected from the destruction of complement system. Nature have given this kind of mechanism to red blood cells. Is that clear?
Yes, sir.
Hello? Okay. Let me just repeat my statement again, right? So normally we know that complements, the complement system and all of its factor, like we discussed different complement pathways, right? So complement system and red blood cells are, a kind of neighbors, right? But complement system is destructive kind of thing, right? Like it's, you can say a toxic kind of neighbor, right? But red blood cell is, cool, calm, it just does its job, it just, deliver oxygen. But what happens? Red blood cell have to be aware of your complement system. Why? Because complement system have the ability to kill it, right? So nature have given a mechanism to to the red blood cell in order to protect itself against complement destruction, right? So if you guys remember, we discussed three pathways of complement system. Remember, three
Yes.
pathways: alternative pathway, and yes, what else? Classical
Classical
pathway, right?
Classical.
and
And
Okay.
lectin.
lecithin mediated.
Okay, perfect. So we discussed that in these both pathways, we discussed that we already know, right? First of all, we are going to have conversion, like activation of C1. C1 is going to convert, C2 and C4 into C2A, C2B, and ultimately we are going to have C3 convertase, right? And C3 convertase further is going to drive the reaction, and in the end, it's going to give us membrane attack complex. Did you remember? And membrane attack complex is the culprit which can destroy your red blood cell or which can destroy your bugs or different things. Is that clear?
Yes, sir.
Yes.
Okay. So what
Yes.
this mechanism which nature have given red blood cell in order to stay away or stay protective from its toxic neighbor is that it would not allow complement system to form C3 convertase. Is that clear?
Yes.
Is that clear? Okay. So you can simply think of it as like decay accelerating factor, right? Which is doing that. But for the decay accelerating factor, it need a pillar. It need a pillar to, sit on that and look for and do its function. That is inhibit your C3. So you can simply remember you have a pillar, right? Which is basically attaching your DAF to your red blood cell, right? So, for example, if I have problems with this pillar, if I do not have this pillar, so can I say that I won't be having DAF there? We do not have side for the DAF to sit and protect red blood cell from complement destruction. Can I say that?
Yes, sir.
Okay. So, for example, we have like what happens in paroxysmal nocturnal hemoglobinuria, where we do not have this pillar, right? Or in other words, this GPI anchor, right? Or GPI anchoring proteins, GPI. Is that clear? So, if we do not have this GPI anchoring, we do not have this pillar, what happens that now your complement is able to kill your red blood cells. Can I say that? Because you have no one sitting there on the pillars to inhibit your complement system. Hello?
Yes.
Okay, so let me just write down the statement. If we do not have the pillar that is GPI, what happens now? Your complement system would start destroying your red blood cell. Can I say that?
Yes.
Can you just please? Okay. So this is the main pathophysiology of this pathology, right? Okay. Can you just please fix your mic, Dr. Shafiq? Okay. Thank you. Okay. So the next thing comes to nocturnal. That why are we going to see such kind of problems or at night? Idea is very simple. Whenever we are sleeping, we know what happened to respiratory rate. Yes, increase or decrease.
Decrease.
Okay. Yes. Anyone else? What do you think? Will it increase or decrease?
Decrease.
Decrease.
Okay.
Decrease.
Whenever the respiratory rate decreases, what happens to the carbon dioxide? Are we blowing off carbon dioxide or we are retaining carbon dioxide?
Retaining
Retaining.
CO.
Retaining.
Okay. Perfect. Retention of CO2. Whenever we have retention of CO2, can I say that it could lead to acidosis because it is acidic combined with H2O, give me H plus and HCO3, right?
Yes.
Okay. So whenever we have acidic environment, we already know that acidic environment favors activation of your complement system, right? So acidic environment favors activation of complement system. So if I do not have this pillar, or in other words, if I do not have this DAF, so can I say that this individual at night would be prone to hemolysis? Because at night when he's sleeping, you are giving a favorable environment for the complement to be activated, right, and to kill your red blood cells. Can I say that? Hello?
Yep.
Yes.
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 Okay. So okay, once complement system is activated, what happens? It would just start destroying your red blood cells, right? Once the red blood cells are destroyed, hemoglobin is going to come out. And hemoglobin, yesterday we discussed, it isn't good for the hemoglobin to, roam around here and there in your blood. Why? Because it can cause a lot of problem. It can activate your coagulation cascade, which can lead to thrombosis, right? Hello?
Yes, sir.
Okay. We discuss a natural mechanism whenever we have free hemoglobin. So what other thing nature gave us for that?
Haptoglobin.
Haptoglobin.
Okay, haptoglobin, right? Haptoglobin is going to, hold the freely moving hemoglobin. And what else hemoglobin can do? It can cause back pain. We discuss how, hemoglobin can cause toxicity of your renal system or acute tubular necrosis, which can lead to flank pain, right? Okay. So can I say that once, if I have a person, okay, let me just give you an overview. If I have an individual who do not have these pillars on which the DAF is going to be attached, and normally it have to inhibit your complement system. So can I say that whenever this guy is sleeping, right? he'll be having complement mediated destruction of red blood cells. Whenever he wake up, you're going to see hemoglobin in urine or simply dark urine. Can I say that?
Yes.
So you have a same exact MCQ in your word. They're going to tell you you have an individual. Okay, you are going to see two MCQs in your word, right? 2 to 3 MCQs. First of all, they're directly going to ask you DAF, right? GPI anchor. What's the main thing which is like or the main driving factor which is like contributing in this pathology. Second, they are going to ask you that we have an individual, he like have like dark urine once he just wake up. So simply think of like these kind of keywords whenever you see, think of paroxysmal nocturnal hemoglobin, right? Okay, not only red blood cell but white blood cells and platelets also have same mechanism, to hide from your complement system or to keep itself safe from complement system. So we are also going to see destruction of white blood cells and platelets. Is that right?
Yes.
Okay. So can I say that the most common cause of death in this individual could be hepatic portal or cerebral vein thrombosis? So can I say that?
Yes.
Because if I have hemoglobin, you already discussed, it can activate coagulation cascade, and if you have venous thrombosis, so it can cause a lot of problems, right? If you aren't like drawing the venous content out of an organ, what happens? It can cause a lot of problem. It can become ischemic, right? Is it
Correct.
clear? Perfect. So this was all about paroxysmal nocturnal hemoglobinuria. We discussed the MCQs which you guys are going to see. So we are going to have like some simple straightforward MCQs based on this pathology, right? So let's discuss our next pathology, that is G6PD, right? So yesterday you saw a lot of MCQ on G6PD, right? So we are going to have a little bit. Okay. So as you guys have already done, so anyone who just want to participate in this, anyone who just knows something about the pathology, yes? Hello, Doctor.
Come
Anyone?
again, Doc. Come again.
Okay, Doctor Shafi, can you just please tell us something about G6PD? What is G6PD? What are you see?
I have question, please, regarding proximal
Yeah.
urea. जी sir, is there what is the role of CD 55 and 59? Please tell me about that also.
Okay, so not only DAF decay accelerating factor, but CD55 and CD59, they are also markers, right? So, okay, so mainly the thing here is that basically we use a test which is known as sucrose test in order to screen individual who have paroxysmal nocturnal hemoglobinuria, right? So first of all, let's discuss that, then I'll be just telling you the significant. By the way, DAF is also known as like the surface marker, or DAF, like another name for DAF is CD55, right? Is that clear? Hello?
Yes, Doc.
Okay. So,
Yes sir, now
okay.
correct.
Okay.
That is the
Before
one
that,
and same thing.
sorry.
DAF and CD 55, 59 are one and same thing.
Okay. So, like, they're almost they do same job, right? They like inhibit your membrane attack complex to form, right? But the other name for CD or for DAF is CD55, right? And CD95, you are saying, right? Hello?
59.
What you are saying? CD
It's
59.
59.
59, right? So you can just look for that what CD59 is, but the main theme is same, right? It's going to inhibit your CD, let me write it down, right? 59, right? I don't
Yeah.
know, you can just see it. I'm not sure about that, right? But DAF is CD55, simple as that. Okay. So basically we use a test that is known as like sucrose test. So can anyone just tell me the idea that what is sucrose test? How do sucrose test, screening tests, tell us whether an individual is having paroxysmal nocturnal hemoglobinuria, yes or no? Yes. Anyone?
Is it cool test?
We have sucrose test.
No, second test.
Yes, anyone, please. You can just think of. Dr. Shafiq.
What is the name of the test, Doc?
Okay, so the idea is that in order to confirm whether an individual is having paroxysmal nocturnal hemoglobinuria. Basically, we did a test that is sucrose test, right, for screening, right? So, what do you think? How do this sucrose test is going to tell us whether an individual is having paroxysmal nocturnal hemoglobinuria?
Is
We
it
will expose him to a acidic environment, and we will see if there is hemolysis or no. Is that the idea? I don't know about it, but I think the concept.
Yes. So the concept is same. Whenever we expose the environment to like sucrose, right? So sucrose lysis test, right? It's also known as ham test, right? So what it does is that it would just create a favorable environment, so and it would just increase activity of your complement system, right? So complement system can be activated with sucrose, right? We discussed mannose binding like lectin, the mannose sugar, if you remember, right? Hello.
Yeah.
yes,
Okay, so sucrose in that case can activate your complement system. The idea is now we are activating the complement system, right? So if we do not have DAF CD55, so what this test is going to do, it's going to cause hemolysis, right? And once it causes hemolysis, we can detect the hemoglobin, which would just confirm that yes, we do not have GPI anchors, we do not have CD55, which can save your red blood cell. Is that clear?
Yes,
Hello?
doc.
Okay. So let's move to our next pathology, that is G6PD, right? So what happened in
Excuse
G6PD,
me,
the idea
doctor.
is, yes, please.
Can you repeat this across test again? I did not understand. Thank you.
Okay. So the idea is really simple, right? You're going to okay, for example, if you have an individual and you are suspecting that he have paroxysmal nocturnal hemoglobinuria, what you are going to do, you are going to take his blood, right? And what you are going to do, you are going to add some sucrose, right? What's the idea of sucrose? Sucrose basically can activate your complement system, right? So if you're activating the complement system, normally if you activate the complement system, your red blood cell have these GPI anchors, they have like DAF in order to save itself from complement destruction. But if it do not have this, now you are going sucrose, complement system is going to be activated. So what happens? It can destroy your red blood cell, which can lead to hemoglobinuria or increase free hemoglobin. So in this way, you can confirm whether an individual is having paroxysmal nocturnal hemoglobinuria or not. Is that clear?
Yes, doctor. Thank you.
Okay. So let's discuss our next pathology, that is glucose G6PD deficiency. So let me just make it so simple and easier. Like red blood cell is it have to roam around like everywhere inside your body. So it is like normally exposed to a lot of stresses, right? And one of
Yep.
the stress is oxidative stress, right? Whenever we have like a molecule, like for example, H2O2 hydrogen peroxide. So what happens? It can generate some free radicals, right, inside your body. I won't just go into the chemistry, but if you guys remember what is free radical, anything which is having a lone pair of electrons, so it is like highly reactive with things. And once it reacted, it can cause destruction, right? You already know
Yep.
that. Or simply, like we remember from our chemistry that free radicals are toxic to your body, right?
Yes.
Okay. So what our red blood cell, like for example, if you have hydrogen peroxide, it can you can have free radicals, right? So we do not want this to develop, right? So for that, nature again have given us a mechanism, right? Red blood cell can have exposure to H2O2, which can lead to free radical formation and red blood cell destruction. So what our body does, as the nature have provided us a mechanism, you are going to have antioxidant, right?
Yes.
Antioxidant. One of the antioxidant is
The NAD pH.
glutathione,
Yes.
right?
Glutathione. Yep.
Okay, yes. So it's an antioxidant. So what do the name suggest? Antioxidant.
It neutralizes the free radicals.
Okay, so it would become oxidized, right?
Yes.
In the process of, and it would the molecule is going to become reduced, right? Antioxidant. It's going to, or in other words, you can say it would just check out the oxygen. Like mostly the oxygen can also be a reactive species, right? It can be your free radical. So it become oxidized, right? In the process of, saving the free radical formation, right? In order to avoid formation of free radical, what glutathione is going to do is going to, become oxidized and it won't let H2O2 to give us or to generate some um, free radicals. So in this way, it would save you or save your red blood cells. Is that clear? Hello?
Yes.
Okay.
Yes.
Yeah, it will sacrifice himself, yeah,
Yes,
to
it would
save the
just
body.
sacrifice himself. Yes, perfect. But this sacrifice, for this sacrifice, nature have given another mechanism because we need this sacrifice always, right, to be done by glutathione, right?
Yes.
What's the second mechanism? That is, yes, NADPH, right?
Yep.
So NADPH, what NADPH is going to do is going to, take out this oxidized or this toxic part, eat it down, and again, it would regenerate your glutathione. Can I say that?
Yes. Yep.
Right? Okay. But how do NADPH come? It comes from a different mechanism. We'll be discussing that in biochemistry in detail. That is by an enzyme.
NAD BH reductase from
Okay.
NAD B. From NAD B.
Okay. So, can I say that it's a byproduct of like G6PD? Right?
Yes.
Yeah, right. So you need G6PD simply. I'm just making it simple, right? Because in biochemistry, we are going to do the details, right? G6PD, you need G6PD for NADPH as well, right? So, this cycle is like connected with one another. Like, let me just repeat it from beginning, right? So, normally H2O2 is toxic for your red blood cell. Why? It can form free radicals. But in order to avoid formation of free radicals, what glutathione is going to do is going to like take the free radicals and it's going to sacrifice, right? But for that, nature has given us NADPH, right? So NADPH would, just regenerate glutathione because we need glutathione for like further in our life to give such kind of sacrifices and save you from free radicals. But an enzyme G6PD is important for that. So can I say if we do not have G6PD, we do not have NADPH. If you do not have NADPH, glutathione cannot be regenerated, right? If glutathione
Yes.
cannot be regenerated, what happens? Free radicals can be formed and it can lead to red blood cell destruction. Can I say that?
Yes, sir.
So
Yes,
again,
sir.
it's going to lead to intravascular hemolysis, destruction of your red blood cell. Is that clear?
Yeah.
Yes.
Okay. So an important point which you guys should have to remember is, okay, here the concept comes of Heinz bodies. So what are Heinz bodies? I think you guys are will be more pro telling me Heinz bodies because you guys have recently done your U word. You guys know every slide, histopathological slide. So can you just tell me what is Heinz bodies?
It's oxide.
His bodies is the heme without the iron.
Okay. So
Remnants.
okay. So can I simply say, okay, let me just make a story for that. So can I simply say whenever we have destruction of red blood cells, so the content within the red blood cell is also going to be destroyed. What is the content within the red blood cell? That is hemoglobin.
Yep.
Can I say that? So
Yep.
can I say that
Yes.
heme bodies are simply the dead hemoglobin present inside the red blood cell? Can I say?
Yep.
Okay, dead hemoglobin present within the red blood cell. But what happens that this dead hemoglobin which is present in the red blood cells, normally what happens once like they're just moving here and there, once it comes to spleen, so our spleen macrophages would just try to eat this dead portion, right? Just dead portion from these red blood cell. Is that right? The dead hemoglobin which is present within the red blood cell, your splenic macrophages are going to eat only that part of your red blood cells. Can I say that?
Yes.
So you can see, for example, if this part is eaten by your splenic macrophages. So can I say that it would just, the structure is going to resemble like, a bite cell. You like spleen is just
Yes.
taking, a bite from it. Can I say that? So
Yep.
that's simple. We're going to see bite cells in this pathology, G6PD, right?
Yep.
Is that clear?
Yes.
Okay. So what happens that you guys should remember that whenever we have an oxidative stress, it's going to lead to like hemolysis. And this oxidative stress can be due to a lot of things, a lot of drugs. Yesterday you guys discussed, right? Some sulfur drugs you discussed, right? Fava beans can also do that. You have a UL MCQ on that, right? So these are all of the things which would lead to like, increased oxidative stress and destruction of your red blood cell causing intravascular hemolysis, right? So Now we have a next pathology, that is immune hemolytic anemia. We have already done the concept of immune hemolytic anemia, if you guys remember, and where the Coombs test, direct and indirect Coombs test, remembered, where in the immunology
Yes.
module, right?
Yes, right.
Okay, so and it was okay. So it was an example of which type of hypersensitivity?
Type 2.
Type
Sure.
2. Perfect. So let's discuss autoimmune hemolytic anemia. The idea was really simple. We discussed. Okay, we have two variants of autoimmune hemolytic anemia, right? So you are going to see a lot of MCQs on in your world. You have a hot one and a cold one, right? Warm or cold or hot or cold? Yes,
Yes.
right. So let me just call it hot, right? Or warm. Okay. So what happens? In warm, the idea is that this kind of hemolysis, okay, as we already know in immunology, so we discussed that it's basically due to type 2 hypersensitivity. What is type 2 hypersensitivity? For example, this is your red blood cell. Antibodies are directly going to attach to the surface of red blood cells, and as a result of that, what happens? Yes,
There will be, yeah.
how
Complement
do
will
we
come
have
and immunize.
destruction?
Complement.
Complement will come and immunize it.
Okay, so please, one by one, please raise your hand. Okay, who is gonna cause destruction? Oh yes, Dr. Shafiq, what do you think?
Yeah, the complement will come and hemolyze the red blood cells on site.
Complement is going to destroy it, or you splenic macrophages? Yes.
Mm-hmm. Yep.
Yes. What do you guys think?
Is it gonna just with the IgG IgM antibodies?
Okay. Okay, that
Maybe
is
with that, yeah,
cold
IgG.
occur. Okay, cold occur whenever we have red blood cells tagged by IgM, right? A big IgM.
Yes.
Understood? And then the destruction is going to be led by your complement system. But here we have IgGs, and here the destruction is going to be due to, yes, that's my question.
Phages.
By the
Macrophages.
ADCC, antibody
Splenic.
dependent cell mediated
Okay,
cytotoxicity.
that splenic macrophages, right? You are just tagging it for the splenic macrophages in order to eat it down. Really important, very high yield. Just remember it, right? You are going to see a lot of MCQs on that. So,
Yeah,
in case of warm hemolytic anemia, it's an example of type 2 hypersensitivity. It's going to tag. It's going to the spleen is going to eat the red blood cell. While in case of cold autoimmune hemolytic anemia, you should remember the IgM, a big IgM pentavalent activating your complement system, and you have complement destruction of red blood cell. Is that
yeah,
clear? This was one of the difference between
yeah.
both
It's
of.
like classic complement pathway.
Yes, classic complement. We discussed classic complement pathway can be activated by IgG and both IgM, but here,
Yeah.
okay, so okay,
C1, C3b.
yes, we discussed you are going to have activation of C1, then C2A, C2B. No, okay, C2 into C2A, C2B, and C4 into A, B formation of
Yeah.
complement, T3 converters and things. Okay, so we already did that. Okay,
Doctor,
what
just
else? Yes, please.
so for the warm and for the cold, in both of these, we're gonna see extravascular hemolysis.
Okay. Okay, so you should just think of, is it extravascular or intravascular hemolysis if you are just eating down in the spleen?
Extra,
Is it within the vessel or without or like outside the vessel?
no,
That is the
extra
question. Okay, so it's an extravascular hemolysis. Okay, here, is it within the vessel or outside the vessel?
outside the vessels. Yeah.
Hmm? Complement
Oh,
system, I
sorry,
think.
the other
Inside the vessel.
Extravascular.
It's in
Okay,
the
please
tail.
raise your hand. Please raise your hand. Okay. Okay, so we have extravascular hemolysis and intravascular. The idea is really simple. What is extravascular? Outside the blood vessel. So spleen, I think, is outside the blood vessel, right? So it's going to be your extravascular hemolysis. But in case of complement destruction, it's going to be intravascular hemolysis.
But doctor, why in the FA they are saying it's extravascular for the
Okay.
cold?
Okay. Remember, you can just like correct it down, right? The code is going to be your intravascular hemolysis, right? So you can like refer to the first shade, no, sorry, the pathoma. So there it is like intravascular hemolysis. Is that right?
Okay,
Hello?
right.
And it makes sense as well. Complement system, like it's present in your blood, right?
Yes, sir.
The factors are present inside the blood. Is it clear? So you should just correct it down, and you should just, as I told you that the best resource for your hematology module, entire hematology module is going to be your pathoma, right? I'm just writing down a task from pathoma. So just follow that, and it's going to help you a lot. Believe me, right? So it's basically intravascular hemolysis. If there is like extravascular written in the first chat, so just don't go after that. Okay. So what happens that it like this antibodies, we discuss a condition SLE, right? You guys
Yes.
remember? In SLE, we discussed we can have a lot of antibodies against different structures with new destruction, right? We discussed that in SLE, we are going to have two types of hypersensitivity. We discussed clearly, right? Type 3 and type 2. Dr. Muskan, did you remember?
Yes,
Yep.
doctor.
Yes. So we discussed type 3 is going to be like, a lot of immune complexes being depositing in a lot of, structures. There they are going to activate the complement system, which is going to lead to destruction. While the pancytopenia, we discussed, or the anemia seen in SLE, we discussed that was an example of type 2 hypersensitivity, right? So can I say that this autoimmune or immune hemolysis can also be seen in SLE? So for example, if you get an MCQ in your U word, right? In the question stem, you have SLE. So please don't forget autoimmune hemolytic anemia, right? The immunes, like the antibodies destroying your red blood cell. Don't forget that, right? Okay. So we discussed about like Coombs test, like a direct Coombs test and indirect Coombs test, right? So I think that's like the easy one. So we discussed in order to look for whether there are antibodies destruction, which are like destroying your red blood cell. So basically, there were two confirmatory tests, right? Coombs test, right? So we have two Coombs tests, indirect and direct.
That.
Indirect Coombs test, the idea was we are like directly looking for the antibodies, whether we have antibodies attached to red blood cells or not, right? So for example, these are your red blood cells. We already know that, for example, if it was a case of autoimmune hemolytic anemia, so we must have antibodies against red blood cells, right?
Yes,
So
right.
what we do in this test, we are going to give IgG, right? Antibodies, simple, right? And if we have antibodies against red blood cells, we are going to see agglutination, right? We discussed that. It's going to confirm that yes, we have antibodies against red blood cell. But in indirect Coombs test, we discussed that we are going to look for antibodies within the serum. So what we did for that, we just took a serum, like serum of an individual which we are suspecting him whether he have autoimmune hemolytic anemia. So for example, if he had this antibodies right in the serum, so what we did next, we just added some red blood cells, right? So if, for example, if this person have antibodies against red blood cells, so what would happen, these red blood cells are going to attach against where these antibodies are going to attach against red blood cells. And now again, we are going to add IgGs, antibodies, right? So what happens if we have agglutination? Again, it's going to confirm that yes, in the serum of this individual, we have antibodies against red blood cells. Is that clear?
Yeah, is it like target cells?
Sorry.
Uh, when we add the IgG.
Okay. So we discussed that here, like mostly in case of like warm hemolytic anemia, we are going to have IgGs, right? IgGs against red blood cells, right? Hello.
Yes, sir.
Okay, so we
Yes.
are going to give anti-IgG. It's not IgG, it's anti-IgG, right? So once
Mhm.
we give anti-IgG, we are going to see agglutination if we have IgG. We are giving something opposite to IgG. If you are giving something opposite, what happens? You are going to see agglutination. Like for example, if I have an individual with blood group A and blood group B, I'm just mixing them, you are going to have, agglutination.
Okay, I got it.
Opposite things, right? So I'm going to give opposite thing if I'm just suspecting that yes, we have antibodies against red blood cells. So let me give you some opposite reagent, right? And the opposite reagent here is going to be anti-Ig. If I see agglutination, it would confirm that yes, I have antibodies or have immune hemolytic anemia, right? So these were some simple things. Okay, so let's discuss our, okay, just give me a second. Okay, so let's discuss anemia.
Doctor,
Yes, please.
just to confirm that in Pathoma, it was shown in the only the cold AIHA is intravascular, but the warm is called is mentioned as a extravascular. So can you
Mhm.
please clear? So
So
I'm a
it
bit
is
confused with your
extravascular.
explanation.
I
Yeah.
did the same thing. I said the same thing. The
Okay.
warm is going to be extravascular and the cold is going to be intravascular. I said the same thing. And it just
Okay.
make a concept you can simply think of, right? Here it's destruction due to spleen. Spleen is present
Mhm.
out, like the spleen is present outside your blood vessel. You do not like see spleen within the blood vessel, right? So it's
Okay.
extravascular.
Yes.
While complement system and all of the mediators are present within the
Within
within
the
your
vessel.
blood, within your
Yes.
vessel. So it's intravascular hemolysis. So simple,
Intravascular.
right?
Okay.
Okay, so let's discuss last topic of red blood cell module. Like today, we have we were about to study white blood cell, but the topics were like long, I would say. So tomorrow I'm just planning to start white blood cells, right? So again, it would just take 3 days, but for today you guys can just have revision, right? So I'll just mention in the task today is your revision day, and in revision day, what you are going to do, you are going to revise you world. Okay, you guys are going to come online in the Discord, right? I'll be there waiting for you. But let me just tell you, and I'll be also, Dr. Laiba and Hamza is also going to tell you guys. So today you guys are going to do revision, right, of random MCQs from the platelets module and red blood cells module, right? Because like it's considered to be like one of toughest kind of system. So I want you to have like a revision for that, and then we are going to start white blood cells module tomorrow, right? Okay, so we discussed that we can also have anemia due to underproduction, right? So what happens in anemia due to underproduction, what we discussed yesterday, that if we have anemia due to underproduction, so what would happen to reticulocyte count, Dr. Hazira? Yes.
Less than 3.
Okay, would it increase or decrease, Dr. Muskan?
Decrease.
Yes, it would decrease, right? So like we're going to have a lot of problems or a lot of pathologies which can lead to anemia due to underproduction. For example, one of which is aplastic anemia. So what happens in aplastic anemia? The idea is very simple. Whatever, like for example, if a person is on chemotherapy, right, and if he have destruction of hematopoietic stem cell, like if you just destroy or kill hematopoietic stem cell, so what happens? You won't be having anyone to make red blood cells. Is that clear? So not only it's going to diminish the ability of forming your red blood cell, but it would also cause pancytopenia. What do we mean by pancytopenia? Everything is going to be low, right? As we discussed. For example, the idea is where, okay, what is aplastic anemia? We discussed that hematopoietic stem cell, CD34, they are going to be dead. How? A lot of things can do that, right? For example, certain chemicals, right? Certain, for example, if you have autoimmune damage of your hematopoietic stem cell, for example, like it can be due to chemotherapy, right? So what happens? You are going to see pancytopenia because the myeloid lineage cannot be made. You do not have the father, right? You do not have hematopoietic stem cell. So it can also lead to anemia, right? Due to underproduction. On the other hand, like we can also have like immunosuppression, for example, and other thing is like, for example, if you have pathologies, right? So for some time we are going to discuss an MSK, the different bone cancers, right? So sometimes what happens is that we discuss the medullary portion where your bone marrow is present. Like for example, if you have a cancer of bone and it's like coming down here and it's occupying the space within the bone marrow, right? So again, you are like demolishing the hematopoietic stem cell. You're mm, destroying, or you're just affecting your bone marrow cells. And on the other hand, the hematopoietic stem cells are also present within your bone marrow, so it can also lead to anemia due to underproduction. And yesterday Dr. Mahin also told you parvovirus B19, it can also go and it can stop erythropoiesis within the bone marrow, right? But it's a temporary stoppage, right? So if you do like a supportive treatment, it can be like reversed. Is that clear? Hello.
Yes, yes, doctor.
Okay. So it was all for today, and tomorrow we are going to start white blood cell. Okay, let me mention like today I was not feeling well. I was just planning that Dr. Taha should just take class, but still I'm here. Hope so you guys enjoyed the class. Hello.
Thanks, sir. Hope you feel
Okay.
better soon.
Okay. So I'm just waiting for you people in the Discord server. You guys can have 5 minutes of break, and I'm just there. We are going to discuss some random MCQs. Is that clear? Hello.
Yes, Dr. Ahmed, I have a
Okay.
question.
Yes, please.
Yesterday, I was trying to connect to Discord, and
Okay.
later on I connected,